Welcome to the Jaros Health Podcast, where we make it easy for you to better serve older adults. This is the weekly Jerry on Ice segment that is a collaboration with the Institute of Clinical Excellence, the official Con Ed provider for the Jaros community. All right, we're live on Instagram, on Facebook. Good morning. My name is Dustin Jones. This is the PT on Ice daily show. It is Wednesday, so that means it's Jerry on Ice. So my name is Dustin. Like I said, I teach modern management of the older adult with Christina Previtt, the 8-week online course, as well as the 2-day live weekend course, which we're headed to California around LA in August. So I need to book my flight for that right after this. So I'm pretty excited about that, but I wanted to talk to y'all about rest. Rest. It's a pretty common thing that we see a lot in our notes. But I don't think it's something that is necessarily very thought out, at least in the physical therapy arena. So I just want to talk about my perspective on what I've been learning, in particularly at the CrossFit box that I'm going to over the past 6 months. So I want to show you all this shirt here. So I joined the local CrossFit gym, I think back in November, based on peer pressure from all the ICE faculty and my wife. I willingly did it. But they give you this shirt once you join. And it says rest later for those that can't. It may be backwards, I'm not sure. But it says rest later. That's like the free shirt that you get once you join the gym. And I saw that shirt and kind of that slogan or tagline. And it rubbed me the wrong way, honestly. I saw that and was just like, that may be why, you may be hurting people in your fitness classes. Fulfilling all those CrossFit stereotypes that we typically have of pushing people too hard, causing injury, blah, 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 all those things that the guys on the Fitness Athlete Friday side of things, they debunk that almost every week. But that was my perception going into it. Rest later. Was not a fan of that whatsoever. And then I started to spend more time in this box. I started to go regularly to the classes and was starting to see a lot of change in my life and was starting to see how they leverage rest in their programming. And the big thing that I was aware of, that I was observing, is that rest was always earned and not necessarily given. Rest was earned and not given. There were some days where we wouldn't take rest per se. You were doing an AMRAP for 8, 10, 12 minutes, however long, and you were just busting it, going all out for that period of time. Or, we were working on building strength and doing, some submax lifts, and there would be, 3 minutes rest built in. It was all very, very intentional. And that rest was leveraged to achieve the desired stimulus of their programming. Now, is that the case in your physical therapy session or my physical therapy session or the PT sessions that we are seeing in our clinics or our hospitals or in our skilled nursing facilities or in the home health setting? Is that the case? And I would argue most of the time it is not. Rest is not earned. It is given. It is just literally given, mainly for convenience, a lot of times in the physical therapy world. Let me tell you just a typical scenario that I've seen and also guilty of is, let's say, you're working with Doris. Doris, awesome job. You just crushed that set of 3x10 TheraBand long arc quad with the green TheraBand. You're doing awesome. Are you tired? And then Doris looks at you kind of, not. Oh, you're tired. Okay. Well, let's rest a little bit before we go on to these next exercises. And then you or me, the clinician, may go to the bathroom. We may go check our phone and see if anyone commented on our Instagram post that we did today. Pretty common scenario. All right, let's say, Doris, you finished your exercise. Great job. Are you tired? Okay, you're tired. Let's go. Let's take a rest before we go on to the next exercise. And then you may go and do a note because you're already behind by 15 notes today. A pretty common scenario. I know I've been guilty of that. You probably have as well. Here's another one. Doris, great job. Are you tired? Yeah, you're tired. Okay, let's rest a little bit before we go on to these next exercises. And then you go and check on that other patient because you're double booked. I mean, how many times have we given rest to people based on our convenience and not necessarily a particular desired stimulus? I will raise my hand and say I've definitely been guilty of that in the outpatient setting, in the skilled nursing facility, and then home health as well, when I'm, just crawling or trying to keep my head above water, to finish my documentation. I think all of us could say we've been guilty of that at some point. And Dale Avers has really spoke to this well when we had a conversation, the Jaros Health Facebook group. Dale Avers, for those that don't know, if there was a Mount Rushmore of physical therapists, she'd probably be on there, especially if it was a Mount Rushmore of Jerry PTs. She's an educator. She's a fellow of the APTA. She basically, helped write the book on geriatrics and PT. But she, in terms of rest being earned and not given, Dale said, love this. Why do we ask our patients if they are tired? Shouldn't we be able to tell if they're tired? We can tell if they're tired when they lose form, when their gait deviations increase or they slow down, or when their vital signs increase. I'm pretty well convinced that we ask patients if they're tired because we are tired. I'm pretty well convinced that we ask patients if they're tired because we are tired. Dale Aver said that. She has trained probably thousands of clinicians at this point, and this is her observation. And I want you to reflect on that. Are you tired? Is that why you are leveraging rest to give you some free time to go check your social media, or to go finish a note, or to see that other patient? Or are you leveraging rest in a very thoughtful, methodical manner to achieve a desired stimulus? We need to think about that. So is rest earned or given? That's the big question that I want us to think about. Alan, I think, spoke to this really well in his Intensity Matters episode that he did. I can't remember the date on that, but just go on the PT on Ice podcast or on the Facebook video page, and you'll see Intensity Matters. Alan spoke to the importance of intensity and the variables that we can adjust to achieve that desired intensity, rest being one of them. And so some practical things of how we can think about rest is, for most of us, we probably should reduce it with a lot of our patients. We make these assumptions that they need to rest, but that is not always the case. We ask the question, are you tired? Most of my patients, almost all my patients, are going to say yes. They're generally fatigued. I'm a home health therapist. I'm working with people. I don't have anyone younger than 85 right now on my caseload. They're pretty fatigued, and that could be relatively normal. So they're going to say, yes, I am tired. And so I'd probably give them rest. Hold on one second here. But is that helpful for them? So how are we assessing this? We, like Dale Aver said, we're observing their form, observing their gait, but more importantly, we can observe their vitals. We can take an RPE or a modified RPE to gauge, where they are. And that subjective report is going to be helpful to help us determine, if they should, get some type of rest. But I think a lovely way that we can really reduce the amount of rest, or really, control it in a more thoughtful manner, is the use of a REMOM. So the Rehab Every Minute on the Minute that Mitch Babcock has coined, and there's an awesome ebook that they've created, and I'll put a link to that in the comments. But something like that is going to control that rest, going to ramp up the intensity of your session, and is going to serve your patient well. Because I know for me, when I say, all right, let's just take a couple minutes of rest before we go on to this next activity, what typically happens is within 30 seconds, I'm like, oh, I could be, finishing this note. I go to, start that note, and then 5 minutes later, that 2 minutes stretched into 5 minutes. So we don't want that to happen to our patients. So REMOMs will get you on the clock and be very, very consistent. So is rest earned or given? The big thing I think that I want to portray to you all is that we really want to assess our patients to see if they're requiring rest. We don't want to assume. We want to assess. And we can leverage rest in particular situations. Let's say we're working on building strength, and we're doing a pretty high load, low rep scheme. In between those sets, you're going to want to take a decent amount of rest for folks. Maybe a couple minutes, 3 minutes, 4 minutes. I know, Christina, when she, is training, she's probably taking 5-6 minutes in between, or more, between some of her lifts. So we can do that with some of our patients, and that's pretty appropriate. But if we're trying to improve their fitness level, improve their conditioning as they're in our care for that short period of time, not a lot of rest is probably a good way to go. But play around with some of those different programming elements like REMOMs, Rehab Every Minute on the Minute, or AMRAPs, as many rounds or reps as possible within a period of time. And that is really going to push people to really get after it and reduce that rest, ramp up that intensity, and probably get more bang for your buck out of your session. So think about that. Is rest earned or given? Stop giving out rest. Make your patients earn it and leverage that rest to achieve the desired stimulus that you're going for with your patients. So that's on the clinical side of things. I really want to challenge you all and urge you to think about. Now on the personal side of things, the benefits of rest later. Going back to this shirt. the rest later shirt. Like I said, it kind of rubbed me the wrong way at first, but then the longer I spent in that box, the more value I found in that phrase. But when you walk into a gym, whatever you're doing, some type of fitness facility, or, whether you're at home, working out, you're going into that time period with the sole focus of bettering yourself, of pushing your boundaries, of getting stronger, of challenging yourself so your body will adapt. And that phrase, rest later, has seeped deep into the core of that fitness community at CrossFit Maximus. And that has influenced me tremendously, to the point of where my perception of what I am capable of enduring has completely changed. So much of me wanting to stop after a certain amount of time, or how I'm feeling after a certain activity, is largely mental. It's largely a mental barrier for me than a physical barrier. And so most of the time, I would say 95% of the time, when I am pushing myself now, I know I can rest later. As before I started this, I would just take a break, and ultimately I was hurting myself by lowering the intensity, not getting as much bang for my buck in those particular activities or those workouts. So I think from the personal side of things, think about rest for you. Rest later. Really adopt that mentality, that slogan, and I think you're really going to be surprised with how that influences your perception of yourself and what you can handle. And I know it's helped me tremendously in many areas of life in terms of that element of endure that Mike Eisenhart talks a lot about on Monday. But this has been a great exercise to consistently flex that muscle of really, being able to push myself and know, what I am, capable of, what's a physical barrier and what's a mental barrier. And we can do that with our patients as well. So rest, is it earned or is it given? Think about that with your sessions. Leverage an actual assessment, whether you're observing or assessing vitals, taking an RPE. Don't just give out rest. Make your patients earn it. Leverage it to achieve that desired stimulus. Don't use it for convenience to check your Instagram feed or the ICE Facebook page, which we would love for you to do that, but you need to serve your patients well. And then rest later. Think about that from the personal side, how you can leverage that to be better, to push your boundaries, to really change the perceptions of what you're actually capable of. All right. Thank you all for listening today. Want to leave you with one thing, and that is a reminder that if you are not on the Hump Day Hustling email, you need to change that. So go to ptonice.com, go to the bottom, name, email, top 5 links, whether it's a research article, a social media post, a podcast we listen to, something that the faculty of the Institute of Clinical Excellence found valuable in their work and in their education, that we send to Jeff. Jeff creates a very simple, succinct email that's jam-packed every week, and it's going out right now, Wednesday morning around 8:30 is when that's been going down. But you can get on that, very valuable. And then on the bottom of that is just a few links of where we're going to be in the near future in terms of our courses. So a very valuable email. A lot of people are getting a lot of value out of that. So go to ptonice.com, check that out, go to the bottom of the page, sign up. Otherwise, I'll talk to y'all in a couple weeks. See ya. Thank you for listening to the weekly Jerry on Ice segment of the Jaros Health Podcast. If you found this episode helpful, you should go to jaroshealth.com to check out our course offerings that will make it easy for you to better serve older adults. Once again, that's GEROS health.com and click on the courses tab. Thanks for listening.